Hey y'all, welcome back to Finance Tea, and today I want to spill some tea on how to lower your medical bills. This is something that so many of us are burdened with, especially nowadays. And especially with the rising cost of healthcare and medical expenses, people are getting sick, these days, a lot more than usual. And so it's a huge burden for Americans especially. And medical debt is one of the leading causes of bankruptcies in this country. It really is. And it's not because people necessarily, don't have insurance. A lot of medical debt come from people who actually have insurance. They're insured, which is a huge problem, right? How am I insured but I'm still in medical debt? Well, it's because, there's a lot of different reasons. One of the reasons is because people aren't choosing the correct insurance for themselves, depending on their situations. They might be underinsured, they might need extra insurance to help them. And then some of the ways are just because the cost of, procedures and things like that are just astronomical, but there's certain ways that you can help yourself in those situations and be proactive when it comes to that. And I'll talk about that later in the video. But for now, let's talk about the ways to negotiate existing bills that you currently have to see if you're able to lower them. So the first thing you want to do is make sure that you're starting early. It's much easier to negotiate, payment terms and things like that when you're a lot earlier in the process. So basically you want to try and negotiate your bill before it gets sent to a collections agency, so you want to negotiate with your actual provider. So what you want to do is you want to either contact the hospital's billing department if you went through a hospital, or your provider's billing agency if you went through a provider, your insurance company as well. So you want to do this as soon as you receive a bill or an explanation of benefits, which is an EOB. An EOB is not a bill, but as soon as you receive either one, usually you will receive the EOB before you receive the bill. And usually, you don't have to necessarily pay right then and there. Hospitals don't, send your bill to a collections agency until, it takes a little while for that. So you don't have to necessarily pay right then and there with your credit card. Just call them up and try to negotiate over the phone. You can even negotiate your bill before receiving treatment if you have a scheduled surgery upcoming, and you want to try to negotiate it prior to actually getting that treatment, okay, or that surgery performed. The next thing you want to do is you want to make sure there aren't any errors on your medical bill. Believe it or not, a lot of these bills come with errors. They make a lot of errors when they're billing people. Depending on what it is, sometimes there's errors on those bills. Now, some of the common errors on these medical bills are like duplicate charges. So they charge you more than once for a procedure or a lab, or incorrect billing. So this means that you're being charged for a service that you never received. Another thing is called upcoding, which basically means that your diagnosis is inflated from your actual condition that you've been diagnosed with. And they're actually billing you for a more expensive treatment or procedure than you actually need. Another thing that they can make a mistake on is unbundled charges, which basically means when you get a group of procedures done or labs done or whatever it is that you get done, which means that they're charging you individually as opposed to under the bundled code, right? So they're charging you on an individual code, which will make it more expensive. Another thing is also an incorrect billing code. This occurs when a wrong code is listed on your bill for a hospital procedure. Now, I know what you're thinking. You're thinking, well, how do I know what codes are for what, and how am I going to know like what's unbundled? Like you can easily see if something's been charged to you duplicate, like it double charged, or if you have duplicate charges on your bill, that's pretty obvious for anybody to see. But when it comes down to more of the more medical jargon, it's kind of like, well, how do I know what codes are for what? Like I'm not a medical professional. I wouldn't know that. How would I know? Good question. I am a licensed health insurance broker. Okay, I'm licensed in Texas. I've been licensed for over 8 years. Okay, so I serve all people who are in Texas and who need their own individual insurance. I actually have a service that I offer my clients, and I actually bundle it under their medical insurance. So that's just an additional little service. It's not a lot of money. It's trust me, it's a lot less than you would get in the ACA or in the marketplace, but it's a service that helps you negotiate bills and all kinds of different things on your behalf. So you don't have to worry about knowing what medical codes are for what, or different things like that. If you see that your medical bill seems to be not correct, maybe more than you expected, then you can contact this service and they will help fight the bill and on your behalf. And so they'll look over it on your behalf. And these people know the coding. They're medical professionals, so they know what to look for. And so if you're interested in something like that, and you want to switch over your insurance, maybe you're paying too much, you think you're paying too much for your health insurance right now, or maybe you don't have health insurance and you need your own individual health insurance, and you're relatively healthy, I can actually put you on a private health insurance plan, a lot cheaper than the marketplace. Get you covered, make sure that you're fully covered and not undercovered, and then also get you this billing service. It's not just billing either. They don't just help with claims. They help with all sorts of other things too, all sorts of questions that you might have regarding your insurance. But if you're interested in that, you can contact me at my email in the description, or you can visit my website. It's flexhealthinsurance.org. Fill out the contact information if you're interested in a free quote. My services are completely free, by the way. I'm a broker, so my company pays me a commission. So I'm your advocate. So if you're interested in that and you live in the state of Texas, let me know. Hit your girl up. Help me out. If you're interested. So anyway, let's get back to the video. The third thing you want to do when negotiating down a medical bill is you want to ask for any financial assistance programs. The federal government and state laws require, providers and hospitals to have financial assistance programs for those patients who may not be able to afford, a medical procedure or whatever it is that they need care for. And this is as long as the service is considered medically necessary. This includes inpatient hospital stays and emergency room visits. Under the Affordable Care Act, nonprofit hospitals must have written policies establishing eligibility criteria for receiving financial assistance and whether that assistance includes free or discounted health care. So these financial assistance programs are known under many different names, such as, charity care, bridge assistance, or simply patient financial assistance. So if you have Medicaid, Medicare, or other medical insurance, you'll need to use those benefits before taking advantage of any other, medical financial assistance program. So, it's important to know that, even though some hospitals, most will have these programs available, they won't let you know about them unless you ask. So it doesn't really hurt to ask. So if assistance is available, you'll probably need to apply, most likely, and you'll have to gather just certain information about yourself, like your tax records, proof of income, things like that. They may ask you for these things, so just have them readily available. And then if your financial assistance application is denied, you may be able to file an appeal. The next thing you can do to lower your medical bill is research the insured rate for your service. Now, and this is if you don't qualify for any, financial assistance program, you'll want to research the insured rate for any services that you receive. And this is what this means. Sometimes healthcare providers will charge more for uninsured patients than insured patients for the same service. This is usually because insurance companies will negotiate with healthcare providers for lower costs for those services on behalf of their patients. But insurance companies aren't the only ones who can negotiate with providers. You can negotiate as well. Now, it's a little bit more complex if you're trying to negotiate without an insurance company, but if you know your numbers and do your research, you can negotiate with the hospital's billing department. So what you want to do is you want to figure out the price that an insurance company can negotiate for the services that you need, okay, or the services that you've already received. So all you have to do is you contact the hospital's billing department and you politely ask them if they can honor that price. And so here's how you find out those prices, okay? Fair Health, that's F, capital F, capital A, capital I, capital R, has a tool where you can research costs for different services and medical procedures in your area. So additionally, you can also negotiate that same bill with the following tactics. First, what you can do is you can offer to pay a discounted bill up front. So any hospital will be willing to negotiate discounted cost if you're willing to pay that cost immediately. So the full cost of that bill immediately. But of course, depending on your financial situation, you may not be able to do that, right? So that doesn't work for you. What you can do is you can use sites like Healthcare Blue Book to determine if you've been overcharged for a service. Now, of course, this comes after you've already been charged, already been billed. But if you want to do that, you can look at Healthcare Blue Book and see if the service that you've received has been, you've been overcharged for that service, okay? The next way to negotiate a lower medical bill is to request or negotiate a payment plan. So if you can't negotiate a lower price, for whatever service that you've received, you can always negotiate a payment plan for that service. So instead of having to pay that bill all at once, you can negotiate with them to break it up into several monthly payments, however many that you think you need for your financial situation. And this will be better to actually negotiate with your hospital instead of waiting for it to be sent to the collections, because hospital bills are interest free. So it's a lot more, financially smart, I guess, to do it that way with your hospital. Another thing you can do is you can check to see if your bill, if your expense is HSA, FSA, or HRA eligible. Most likely, whatever service that you receive that's medically related is going to be eligible for your health savings account. Whether it's your health reimbursement account, which is given to you by your employer, or your HSA, which is paid by you. Sometimes your employer contributes to that account as well. Or your FSA. Usually these accounts, except for FSA, depending on what kind of FSA account that you have, usually your health savings accounts, all of the procedures that you receive regarding your health care are eligible for those accounts. You can actually use the funds that are in those accounts to help pay down your medical bills. So the next thing you can do, if you have an employer, is to see if your employer offers a health stipend. Health stipends are similar to an HRA. They're taxable benefits that allow your employer to reimburse you for your medical costs or your medical bills. It's similar to an HRA. Because these stipends are taxable, there are less restrictions on which benefits are eligible for reimbursement and also who is eligible for the benefit. So there's a lot less restrictions. For instance, a health stipend doesn't require you to actually have health insurance to be eligible for the reimbursement. Just keep in mind that if your employer does have a stipend, you will be taxed on that reimbursement amount, and it will appear on your W-2 as income. So if none of these options work for you, there's still one more thing that you can actually look into. If you qualify for a 0% APR credit card for an introductory period, you may be able to make interest-free payments for 12 to 18 months. Additionally, medical credit cards are available as well at lower interest rates, and so that you can pay for your medical costs over time. Sometimes opening up a credit card when it comes to paying for medical expenses is just the best option for a person, you know what I mean? So I hope this video was helpful for you. If you liked it, give it a thumbs up. If you want more content like this, be sure to subscribe to the channel. Help your girl out. Hit that bell to be notified when I drop my newest video. Until next time, y'all. Bye.